Um, well, I have a rare muscle disease. I've talked about this before. Um, it's called polymyositis. It is basically where your immune system sees your body's muscle tissue as essentially a disease or food, and it feeds off of it. I ended up pretty screwed up for a while. I had to learn how to walk again and everything like that. That's doing well. The only problem I have now is that my toes on my left foot. I had a stroke while I was in the hospital. This was in 2012. I had I don't know if I can make you guys see the scar or not, but there's like a little line right here. It's bumpy. But anyway, it looks like a vein, but right over the vein is the line. You can still see the suture marks. Basically, I had a hematoma on the site where the muscle biopsy was done to diagnose this, and that's where the incision scar is from. Okay. He never came back to look at it. I mean, he didn't do anything. We asked the nurses. My mom and I both, we counted the other doctors. I had like 4 teams of doctors. I was in a university type medical facility. And they dismissed me, not without a thought. It began to swell, and get twice the size it usually runs. And it became inflamed and swollen and hard and hot and sore to the touch. And the nurses would come in. There was 2 of them that come in, and they just enjoyed poking on it. I'm like, get the fuck out of here. I don't want you poking on my arm. It hurts. So I went through all that. I was walking again. I was laying in bed one night, and I raised my arm up, and that's the last thing I remember before I went stupid. I mean, literally, you go from the mind of... I went from the mind of a 25-year-old, okay, to the mind of maybe a 3 or 4-year-old kid in the time frame of like 10 minutes tops. Okay, so I get that over with. A few years down the line, see, 13, 14, 15, 16, 17. I'm at the 5-year marker this year. They say if you don't have any issues with your heart or anything by the time 5 years is up, then you're going to have a normal lifespan. I did have a lung issue, because this feeds off all the muscles. So your heart, your lungs, your liver, your brain, anything can be food for it. So I was prescribed this medicine called methotrexate. It's the number one, supposed to be the big bang, great deal of medications to treat this disease. Because as you can see, I've been on prednisone for many years now. It's caused weight gain in my face. I don't have those thin, sunk-in cheeks that I used to have. I mean, I do have them. They're just underneath all this extra fat. It causes an extra layer of fat under your dermis, your skin. Okay, and it also causes weight gain in the belly, which I have a lot of. I have more belly than I have anything else. It also, I have two benefits from it. It deepened my voice, and it did redistribute some of my weight. I have no more hips anymore. Okay. However, my feet and legs are swollen constantly. I am constantly drinking H2O. It also made me diabetic, and it raised my blood pressure up a few notches. Which is okay, I'm on medication, it's fine. I got my diabetes under control. I won't be diabetic when I get off the medicine. Well, not as diabetic as I am now. I'll put it that way. I'll probably be more borderline diabetic when I get off the steroids completely. Excuse me. But, yeah. So I was on this medicine called methotrexate. As it's called a steroid-sparing agent. Okay, well, I lowered my dose of steroids every time we raised my dose of methotrexate. I went from one pill. I started with one pill, and by the time, I want to say, by the time 6 months was up, I was taking 8 pills of this methotrexate, which is also a cancer drug. Its first use was a cancer drug and an anti-rheumatic, which I have neither rheumatoid arthritis nor do I have cancer. But it can cause cancer, and people that don't have cancer take this drug, which, sometimes the side effects of these medications piss me off. Why, if they can make Charlie Sheen's blood, the HIV in his blood, undetectable in a blood test, why can they not work hard enough to make my disease undetectable to me? Without trying to kill me in the process. So anyway, I go off this methotrexate because I have an ingrown toenail. And being diabetic with an ingrown toenail is not a good thing. Morning. Grandma wants you. Something about towels.
Oh yes, Captain.
So I get off this medicine, and in the next 24 to 48 hours, I start presenting with a cough and not feeling good and just general ugh. Okay, well, I think I'm getting some kind of bug. And this was July, mid-July, because my appointment was in late July, and I had to go off of it for at least 2 weeks. So I go off the medicine, I start getting sick. I get out of the car one day, and I cannot breathe. I mean, it gets so bad that